from theheart.org, Medscape Cardiology. This is the Bob Harrington Show. Dr. Robert Harrington is the Arthur L. Professor and Chair of Medicine at Stanford University. This podcast is intended for healthcare professionals only. Any views expressed are the presenter's own and do not necessarily reflect the views of WebMD or Medscape.
Hi, I'm Bob Harrington from Stanford University, here at the American Heart Association meetings in Chicago. I'm on Medscape Cardiology and theheart.org. During the course of many of these interviews over the years, we touch upon a lot of topics. We talk about science, we talk about hot topics or controversial topics in the world of cardiovascular medicine. Today I have one that I hope in particular maybe my mid-career and senior colleagues will take a careful listen to. I've been intrigued at this point in my own career at people making decisions to do something else than what I'll call traditional academic medicine or traditional clinical medicine. And what are some of those other things you can do? Well, at this meeting, I happened to run into two really good friends and close colleagues, and I asked them, would you sit with me for 10 or 15 minutes and talk to me about why you recently made a decision, in this case, to move from academic medicine to industry, one into the technology sector and one into the biopharma sector. So I'm really pleased to be joined today by Mintu Tarakia. Mintu is a professor of medicine at Stanford University, and he's also the chief medical and scientific officer at iRhythm. Mintu, thanks for joining us.
Delighted to be here. Thanks, Bob.
And second is my very long-time friend and colleague, Dr. Magnus Oman. Magnus is formerly a professor of medicine at Duke, and he's now a VP of global development in cardiometabolic at Amgen. Magnus, thanks for joining us.
It's great to be here with you again, Bob.
And don't worry, Magnus, I'm not going to tell all those stories of when you and I were young faculty members. I'm just going to concentrate on being senior faculty members.
That is very good. I'm looking forward to this.
Well, let me start with you, Magnus, because you and I chat regularly. And you have been an academic cardiologist for a long time. I would say really at the height of academics. You lead a lot of studies. You're a revered clinician. Patients come from all over the place to see you, successful fundraiser. I mean, every box is ticked for you in academic medicine. Leader, researcher, educator, administrator. You've been a chief of cardiology. Why now make this jump?
Well, I think you just ticked all the boxes. The issue is, the way I saw it is that this was an opportunity to sort of go back to clinical trials, but do it on the other side of the fence. You know, clinical trials are very frequently carried out by academic research organization or CROs. I have really enjoyed those years that I have done that. And I saw this opportunity to sort of learn new things on the other side of the fence. There are many differences, but yet the outcomes that we want to achieve is better outcomes for our patients, better outcomes, better trials. And in that realm, things are aligned. We can do better.
Now, one of the things you gave up, so to speak, is clinical medicine. Now, not only did I work side by you in the cath lab for years, I was in part trained by you in the cath lab. I mean, you're a superb interventional cardiologist, great clinician, ran the advanced coronary disease program at Duke for many years. How did you give up clinical practice?
Well, that is the harder part. And I have to give credit to my wife, Elspeth. She said to me, because I was really uncertain about this, because yes, you're right, to be a clinician and work hard in clinical medicine and then say goodbye to your patients, it's a hard step to take. I think everybody's sort of fretting a little bit about this. My wife, who's Irish, as you know, she said, what are you wondering about? At some point, you're going to have to give them up. And you have to sort of say goodbye at some point. And so why not do that in a controlled manner where you actually can do it, organize it, set all the patients up with all your friends, cardiologists, and they can get well taken care of. So for me, she sort of gave the answer to that specific question. At some point, we all have to do it. So for me, I just did it a little bit earlier. And yes, patients might be upset or concerned, but once you provide a home for them in some way going forward, they're okay with it, at least the ones that I have taken care of.
Boy, there's so many things to unpack there. First off, I am not surprised. I've also known your wife for decades, and to get wise advice would be not unexpected, I would say. But there's a lot of things that we're going to come back to. Yeah. Let me ask you, Mintu. You're at a different stage of career than Magnus. You've only recently become a professor. You're enormously successful. I would say that your star has been like this in academic medicine. You've already led some amazing tech-oriented projects in cardiovascular medicine. As your both former and current chair of medicine, I about cried when you told me that you were going. Why did you decide to do it?
Yeah, it's a great question. So in my case, I have not checked all the boxes, and there was an enormous runway and a huge trajectory and for the things I learned. And it was great. There was no better job that I could have thought of. I wasn't looking, eyes were wide open, focused on what we were doing, all the great work that you know about across AFib, clinical trials, health technology, the Center for Digital Health that we've put together. It was great. The opportunity here snuck up on me and came to me. And it was an opportunity to take all of that and lead a relatively small public company at a period where there's huge table stakes and opportunity in front of it to really grow, expand, and scale. And for me, it was an opportunity to work specifically with a CEO who was just really good, where I could learn a lot of additional skills on my professional development path. So it wasn't that I was, it wasn't because I wasn't fulfilled and happy and productive. It was an opportunity that when you look at what I can do and the ability to lead an organization, a corporation, help guide it through a process of change with a new CEO who's done this, from whom I can learn a lot. The way I felt about it was, here is an opportunity to develop a highly translatable skill set in executive leadership, organizational change management, that happens to be aligned with the things I care about and work on: AFib, health technology, digital health, software, and AI. And also the opportunity to own all of those areas where we can go fast and take the science that we do, deliver the science and do it from the other side, as Magnus said, but also to think of how we can innovate on the products. And that was the framework that I had. And I went through a whole process of decision-making and using frameworks that we can talk about as well. But it was really, as I see it, part of a journey as a clinician and a scientist, where those skills could be brought right back.
So you've both had some things I want to go back to. You've both spoken, I think it's one of your early comments, about continuing to learn. It's a topic I want to come back to, so start thinking about that. I also want you to think about the opportunity to educate, and maybe in a different format. But Mintu, I mentioned that Magnus retired from Duke. He stepped aside, said goodbye to his patients. You didn't retire. You're on a leave of absence.
Yes.
What's the difference?
Yeah, so that's a great question, I think relevant to the audience here. There's many forms of doing this. There's sabbaticals, there's leaves of absence, there's clean breaks. And what we are very fortunate to have at Stanford is a supportive environment, and I think most importantly, a culture where we can do this. And I'm not the first. There are many before me, both in the School of Medicine and in other schools at the university, who've done this, with the idea that you can take a little bit of a detour and learn some skills, see how those culminate in your life, and then determine how you intend to take that and bring them back. The other part that Magnus touched on was patient care. And in my kind of own professional and clinical journey, I'm not ready to give that up yet. So the way I address this is, look, I started in June, as you know. I went head down 4 months, focused on that, no clinical anything. And I also wanted to see how that felt. We obviously had great clinical transition plans and leadership plans that you and I and others worked on, so the patients were getting good care. We had planned all that. I missed the clinical work. And what I'm in the process now is at the VA, while on Stanford leave, re-engaging back in the EP lab. So I would say what's really healthy is to do that under leave. And you also need a culture on the side that you're joining on the other side of the fence.
That allows that.
That not only allows it, that embraces it, right? So they actually view this as a value add for the company. This is not like giving Mintu clinical time as you would give someone time to play golf. This actually adds to my role and purpose.
I only smiled because Magnus is one of the biggest golfers I know. So Magnus, let me jump back to you. You said something interesting. I want to learn new things. Now, you and I had an office next door to each other for decades.
Yes.
I look at you as one of the world's best clinical trialists, best clinical researchers. What do you have left to learn?
Well, so I think both of us, all of us know that clinical trials can be done better. And so what I see my role is really to take some of the things that I learned in the academic sphere and say, within the corporate sphere, saying, okay, so this is what we traditionally do, but there are other ways. And part of it has been through my exposure through the FDA and other agencies that I've been involved with. There are better and simpler ways to do things to get an answer. And part of it is, of course, having faith that you can deliver on doing that. And my hope is that I will do that for Amgen and actually bring out new ideas that we can sort of tackle in the clinical trials realm, because I think that's so important. Trials are getting more and more expensive, and we really have to sort of break it somewhere and sort of simplify it and make it work. So while I'm learning a lot, mostly about forecasting and all these other things that I didn't know much about before, I'm also hoping that I'm bringing the other things that have value on the clinical trials operation.
Yeah, it's nice to get the two sides together.
Yeah.
Mintu, I'm going to ask you a different part of learning, and that's the teaching part. At Stanford, you are one of the most popular mentors in the Department of Medicine. And already you've trained a lot of people, including some of our junior faculty members. How has that given that up? I mean, you're one of the founders of our Center for Digital Health. You have a whole fellowship program at the Center for Digital Health. You have a bunch of young people who want to be like Mintu. How is it stepping away from that? Or are you going to play another role in mentorship?
So that was the hardest thing. That was the hardest thing. And as you know, I agonized over transitions, mentoring, who should mentor people, what do we do with these programs, how do we support them? It was the hardest part of the entire thing. And it's still hard. On the other hand, it's great to see that they're shining now and just doing great things. So part of that, I'll first speak on the decision framework and then get back to the mentoring. So there's a lot of ways to make these decisions. You obviously need to be in a culture where we can be open and choose. And so again, with you and you being my mentor and helping me guide me through these decisions, I don't think I could have done it alone. You worry about what's going to happen to the things you've built, what's going to happen to the programs that are in place, what will happen to all those people that depend on it and all the employees you have. And those are highly consequential things. In the whole process of self-discovery, what it finally came down to me was a framework that Jeff Bezos, of all people, framed. And there's a great YouTube video on this from when he decided to leave being an investment banker and create a bookstore out of his garage.
Sell books.
Right. He calls it, and it's now called the regret minimization framework. And so the idea is, if at age 80 or at the end of life or X number of years down the road, how would you feel if you didn't try this? And once I had the clarity on that distillation, it was a much easier process, because now you focused not on the decision, the inputs of the mentoring as part of the decision, but a decision around regret minimization, and then a very active process to figure out the mentoring. And as you know, with your support and everyone we have also in CVMed and the VA, the grants, the programs, in many ways have accelerated, I would argue, our junior faculty and enabled them to flourish, because now they're owning these programs. And you look at some of our great stars here, they've done that. And so that's been a delight to see.
Yeah, no, you've done that very well. All right, we have time for about another minute. So I'll give you each about 30 seconds. Piece of advice you'd give the audience who are going through the same career reflections. Magnus?
I think the best thing is to, what mentors say, is basically to say, okay, at the end of your career, what was it that you would have wanted to do versus that you didn't do? And what are the pieces? Because I think we grow personally much more if we try new things and try different things, so that we can have a fulfilled life. And part of my thinking was around that as well, in a different format.
Yeah, and at a different stage, which I think is an important conversation, that these conversations take place mid-career, more senior career. Mintu, what's the piece of advice you'd give the audience?
Have open, honest conversations with family, friends, mentors, chairs, all the people around you. Let them know what's going on. Think through the decision framework that works for you. I mentioned one, there are others. Never try to time this. Don't go looking. These decisions come when you least expect them, and that's a good thing. But that may be leading to a willingness to understand the timing of that decision around all the other people and the consequences you can have. So that once you know, time it and plan it well.
I'm hearing from both of you, there's both opportunity and intentionality. And you want to make sure that you're embracing opportunities, but being very intentional about it. You both obviously gave this a lot of thought. And so I'm just waiting to see what the two of you do. You're both super talented individuals. I want to thank you for sharing your wisdom here on Medscape Cardiology and theheart.org. Our guests have been Dr. Magnus Oman and Dr. Mintu Tarakia. Thank you both, and thank you to the audience for listening.